Hey guys, Dr. Andrew here from Chiro Wellness Center. Happy Friday to all of you. This week on the Chiro Couch, we've got some questions need answering from some patients of mine that ask when they're in the beginning of their care, okay? Now, I thought I'd chat to you about why we schedule you, how we come up with that type of care that you need, because it's a common question. And the biggest misunderstanding that with chiropractic care and your health is how much care you need after your initial consultation. Now, we go through this with everybody, but everybody is different. There are lots of determining factors that we need to consider to create your schedule or your frequency of treatments. Now, some things we take into consideration are what is the problem with your spine? So for example, do you have scoliosis, a disc bulge, or just simple muscle pain? Have you had any previous trauma? Is it severe motor vehicle accident or is it just a mild sprain? What stress are you under? You know, chemical, physical, and emotional stresses can aggravate your condition. These all have a part in the body when we're aggravating our spinal subluxations. Your occupation, how long you've had the problem for, what have you tried, what have you not done? It all adds up to our recommendations. And sometimes people come into our office thinking that it's a couple of treatments and they'll be fine. Now, while their pain goes away in maybe a week, their spinal condition may have taken 10 years to get there, and it may come straight back. It's sort of expecting, to get fantastic results in a short period of time, and it's unrealistic. I use the straw which broke the camel's back scenario in these things. So in our practice, we have 3 phases of care. Now, the first phase of the care is the patch, and this is urgent pain. You might have twice a week treatments for 4, 6, or even 8 weeks of care to get you feeling and moving better. Now, the second phase of care is the corrective. This is my favorite part because this is where we make changes to your spine and we actually improve it. We make you better than you were before you actually hurt yourself. And if you don't want your pain to come back, this is highly recommended. And some of our patients are candidates for chiropractic biophysics, where we call it traction. And this is where we correct your spine to where it should be. In other words, we fix the cause and we don't mask the effects. Now, if you fix it, you want to maintain it. And maintenance part of care is what most people do. Now, this is when you've done all the hard work, you're doing all your exercises and stretching at home, and you come in for regular treatments just to keep it moving. Some people are fortnightly, 3-weekly, or even monthly, and this depends on your spine and how good a results you got. So as you can see, I could go on forever about how we work out your schedule of care. But the other thing we do here, not other people do this, is your reassessments. And I like to find out exactly how you're going. We like to do reassessments along the way to make sure that we're not over-treating you and we're not under-treating you and getting you the results that you want. So I hope this answers your question as to why you need to come in so much at the start of care and why you might need to continue with care there afterwards. I guess it's all based on what your goals are. So, my name's Dr. Andrew from Chiro Wellness Center. I hope you have a wonderful Friday and a fantastic weekend. I'll see you all next week. Bye for now.